Good evening, I'm Dr. Akl. Follow up on once patients know they have cancer, they should not panic until staging is complete. What type of cancer they know, they sit with their cancer specialist to discuss with them pros and cons of treatment. Then they need to understand options of their treatment in terms of benefits versus side effects. Each option need to be presented to them by the discipline give that treatment. The surgeon need to discuss surgery, radiation, doctor need to discuss radiation, chemotherapy, doctor need to discuss chemo. Then they need to select what treatment suit them the best. Then they need to go for the treatment. They need to have compliance with the treatment. They need to understand the potential side effects, and they need to do preventive measure to these side effects. Once cancer treatment is completed successfully, they need to do follow-up protocols, as these follow-up protocols will detect cancer if it come early. They need to refrain from smoking and drinking if they were. They need not to listen to other patients or their friends who have the same cancer and they got different treatment, because each patient is different. You cannot compare apples to oranges. Patients need to have understanding that their cancer is different. Each treatment which would suit them the most could not suit their colleague, friends, and so on, even though if they are the same stage, age. For example, younger patients like to have more aggressive treatment, older patients like to have less aggressive treatment, of course, without compromising of cure. Radiation treatment nowadays is given precisely to the tumor. Thanks to the new technology, we able to pinpoint a radiation to the tumor without giving too much radiation to neighborhood tissue. That results in pushing the dose of radiation much higher, so you control the tumor way better than 10 years ago, and also you get way less side effects. So these all help in bringing a chance of cure is very high. Patients need to be brave when they select the option of their treatment. They need to be they need to ask all kind of questions, and they need to get all picture clear before any decision. And one thing here is the family doctor helps sometimes for those vulnerable patients or weak patients or patients and unable to make decision. So family doctor usually help because he's like the maestro of organizing care, and patients need to talk to their family doctor if they are confused and they don't know what to do and they do not know what treatment option they need to pick. For those patients who undergo radiation treatment, they need to understand that they are not radioactive when they go home. It's like having chest x-ray. The moment you get the chest x-ray, that's where radiation go through you. But when you leave the room of x-ray, there is no radiation in you. You are not radioactive, and you could carry your babies and so on. That's true if you are treated with external beam radiation. However, if you are treated with radiation going through you, like seed implant, when you have seed implant, this is radioactive source in the prostate. Yes, you have some radiation coming out of you, even though it is tiny amount, and that decay and decrease by time. Or if you have thyroid cancer and your treatment is radioactive iodine. That's where you swallow the radioactive material, and that's spread throughout your blood, going to the cancer and thyroid gland and destroy them. Yes, you are radioactive. However, you're only radioactive for a few days. After that, the radioactivity will disappear from your system and you are normal after that. In case of seed implant, it could take a few weeks. The activity will go down, but it would take months to years to be very, very small. However, you are not harmful if you keep the distance from the children and the public. And so you need to keep distant away if you have the radioactivity inside you, even though it's small. But you don't want to give radiation to someone who you don't have to, by keeping distant away. And also, if your type of cancer or the treatment will be washed up, you need to drink a lot of fluids that will wash it, like in case of I-131 for thyroid cancer, where radioactivity is excreted. And this is the only two type of radiation and will be inside the patient. But the radiation, external beam radiation by linear accelerator, you are not radioactive and you will be safe. We talked about once the treatment is completed and you do follow-up policy, you must stick with it and make sure you stop smoking and drinking alcohol, and refrain from bad habit, and live healthy life, exercise, eat healthy, and so on. By doing that, you will get the benefit of every aspect of cancer treatment, and you live normal, and God willing, the cancer will not come back. Follow-up important in many cancer. After a few years, the chance of cancer coming back in certain cancer would be very small, like colorectal cancer. After a few years, the chance of such cancer come back is extremely small, because this is the nature of this cancer. Like after 2 years, the chance is very small. After 5 years, is almost very rare if colorectal cancer will come later. So follow-up will be only few years. Other cancers, the cancer could come back even after 30 years, like breast cancer. However, the chance is not high. The chance would be very small. The chance of cancer coming back will be smaller every year, the further away from the treatment. So it's so important to stick with your doctor during follow-up. And the good news, majority of those patients, the cancer do not come back, and it's called Turkey. So you need to have faith in God and not use bad stuff.